Everyone, a very warm welcome to you all for the today's 7th Ghai, Dr. O.P. Ghai Memorial Oration at AIIMS, New Delhi. Now I welcome Professor Madhulika Ma'am, Head Department of Pediatrics, for the welcome address.
Good morning, everyone. Respected Professor P.S.N. Menon and Madam Beena Menon, Shri Karan Singh, our ADA, Professor C.S. Bal, Dean Examination, Professor Govind Makharia, Associate Dean Research, senior faculty who has joined. I'm really thankful to Dr. Lobo, Dr. T.S. Jain, Dr. Naseem Shah for joining this oration. Thank you very much. Dr. Goswami, colleagues from the department and other departments of the institute, and also DM residents, other fellows. I welcome you all on behalf of the Department of Pediatrics, AIIMS New Delhi. First of all, I would request Dr. Vandana and Dr. Rajni to welcome Professor Menon with a bouquet. So first of all, I would like to thank you all for joining us in this very, very precious event of our own department and the institute. Our multidisciplinary department, which is under one umbrella, is actually a unique example that has developed subspecialties under the same department, which have been nurtured over years. And the origin of this concept was actually Dr. O.P. Ghai's as early as in 1960s, where people were not thinking of development of specialties. And even at that point in time, specialties which were non-existent in even other parts of the world, like genetics and all, he envisaged that we should start those specialties. So, based on this, we have had multiple specialty development in the department, and we have many DM courses which are within the department and running very well. So, Dr. O.P. Ghai's oration, this is the 7th Dr. O.P. Ghai's oration, and today's oration has been awarded to none other than our dear Professor P.S.N. Menon, who established and nurtured the division of endocrinology very early on. I was fortunate to work with him in the genetics unit when Professor I.C. Verma superannuated, and I was really amazed to see his meticulousness both for the administrative work and patient care. Even now we come across many of his OPD cards and old clinic files, and they are really, everybody admires that, and I think the resident should even now look at those files and OPD cards, which were so explanatory and beautifully written in very nice handwriting. So, sir, I welcome you here and congratulate you for this award of this oration. And to deliver today's oration, I would now request Dr. Govind Makharia to introduce the oration, please. Thank you very much.
Professor Menon, Mr. Singh, Karan Singh ji, and Dr. Bal, Dr. Kabra, dear colleagues. I think it's a great day today that we are here to celebrate the legacy of Dr. O.P. Ghai. All you know, Dr. O.P. Ghai has been doing of pediatrics in our country, and he has established a department. Coming to training of Dr. Ghai has started his training in Lahore Middle College, but during partition he has to move from Lahore to Amritsar, from where he's completed his undergraduation, and then he got his post-graduation in Delhi. So ever since then he joined AIIMS, 1959 he joined AIIMS, and he started Department of Pediatrics. And since then he has been in the Department of Pediatrics till he's superannuated. During his tenure, a lot of things happens, as Dr. Kabra said, that multidisciplinary. I think this is one of the unique example of departments who allowed early on that time to divisions of different divisions to enhance the development of different specialty. That's one thing which is remarkable about Department of Pediatrics, and it all happened because of leaders like O.P. Ghai. After his once he joined department, he continued his training, and he went to Harvard Medical Center for further training, and also he was awarded Rockefeller Foundation Award. Dr. Ghai structured the department in such a way that specially developed, and this is one of the unique example we just said. He also former dean of at AIIMS. That's a wonderful thing. Coming to the clinical part, he was a very great clinician. He research interests were mainly diarrheal diseases and a lot of work in that. But most important, which highlights his lifetime, that he was a great teacher and a role model. Teaching-wise and skill of writing, he wrote a book which everybody knows. I think everyone reads that book in our country, The Essence of Pediatrics. And that's still now the book is like a Bible for pediatrics for undergrad and postgrad. It is said that leaders create more leaders. And we know that in our institute, Department of Pediatrics, how the faculty are. Each one is a leader. And we have luminaries in the Department of Pediatrics. And that's an honor of AIIMS that Department of Pediatrics had so wonderful people from this department, one of being Dr. Menon too. Coming to his leadership as a national leadership, he was the national president of Indian Academy of Pediatrics, and also he organized the first International Congress on Pediatrics in India in 1977. He was bestowed with multiple fellowships and awards, and to name a few of them, he was a fellowship of Indian Academy of Pediatrics and also National Academy of Medical Sciences. In addition, he received the Insignia of Merit Medallion Award by International Academy of Pediatrics. As a person, he was very friendly and informal, and one important thing which highlight that he learned respect out of, not out of authority, which many of us do that, but out of his power of integration, power of meeting people, and power of ideas, and his humbleness. Dr. Ghai was truly visionary, and his name will remain, is etched in the golden words in the history of AIIMS, not only of AIIMS, but also Indian pediatrics. The work he did for the country and the upliftment of children of our country is remarkable. And therefore, it's most appropriate to celebrate the legacy of Dr. O.P. Ghai. And in that regards, Department of Pediatrics have initiated a memorial lecture on his name, which is the most appropriate. This lecture was delivered earlier by Dr. Mehervan Singh, Dr. I.C. Burma, Dr. R.N. Srivastav, Dr. Veena Kalra, Dr. V.K. Paul, and Dr. A.K. Deorani, and this year, Dr. P.S.N. Menon. I think we are here only because we have risen on the shoulder of those giants and people like O.P. Ghai. So with that, we would like to congratulate Dr. P.S.N. Menon for selection for this oration. Thank you so very much.
Thank you, Professor Makaria, for that introduction to the oration by in Dr. O.P. Ghai's memory. And indeed, the Department of Pediatrics will forever remain indebted to Sir, and we all strive zealously to carry the legacy of Dr. O.P. Ghai forward. And now it's my proud privilege to introduce Professor P.S.N. Menon. Of course, to most of the audience here, Sir needs no introduction, but this is the protocol, and here we go. So Dr. Menon had done his MBBS from Medical College, Kozhikode, and after that he did his MD Pediatrics from AIIMS, and he was awarded the Best Resident Award, the Sorel Catherine Award. And he joined as faculty in the Department of Pediatrics in 1981, and he was in charge of Pediatric Endocrinology Division. Basically, he was a pioneer. He initiated this division, and he really carried the pediatric endocrinology specialty in the country to where it is now. He was also the professor in charge for the WHO Collaborating Center for Genetics from 1999 to 2003. He was the sub-dean of AIIMS from 1991 to 1997. He was also an adjunct faculty member of CMET at AIIMS. In 2003, Sir left AIIMS and he joined as consultant head at the Department of Pediatrics, Jabbar Al-Ahmad Armed Forces Hospital, Kuwait, from where he superannuated in 2023. Sir really is a pioneer for the specialty of pediatric endocrinology in India, and under his leadership, this was AIIMS was the first training facility for pediatric endocrinology in the country, and he established the first multidisciplinary DSD clinic. Growth hormone and GnRH analog therapy in India was pioneered under Sir's leadership. Sir, of course, has been at the forefront of medical education by being an editor of very widely read books, including the IAP textbook of pediatrics, postgraduate textbook of pediatrics, and 2 textbooks in pediatric endocrinology. He's also currently the editor-in-chief of the Journal of Pediatric Endocrinology and Diabetes. Sir has more than 150 publications in high-impact journals, and he has done research projects as PI under NIH, WHO, DST, ICMR, DRDO, and AIIMS. We welcome you, sir. We are indeed honored to have you with us today for this oration.
Now I welcome Professor P.S.N. Menon, sir, for the today's oration. Welcome, sir.
Thank you, Dr. Madhulika Kabra, Professor Bal, Professor Govind Makhe, and all the members and my distinguished alumni colleagues from AIIMS, Dr. Thilojan Jain, Jennifer Lobo, Naseem Shah, distinguished faculty from Pediatrics and the genetic unit of Pediatrics, as well as many of my colleagues and friends in the Department of Pediatrics. It's a proud moment for me to stand before you here and give this oration of Professor Om Prakash Ghai, who was my teacher in pediatrics. And I think I am blessed to be awarded this oration, and it has given me a chance to come to AIIMS once again and be amongst you. It is a lot of memories flood my thoughts, and probably I may get little overwhelmed discussing about the development of the specialty. This specialty would not have come. The development of pediatric subspecialty endocrinology would not have come without the vision of Professor Ghai. I joined pediatrics department as a postgraduate in 1974, finished my MD, then I was planning to go out. He said, no, you will stay back and work as senior resident in the department after the 77 International Conference. He said, you will sit with me, not only do senior residency, but help me to edit the book I am going to bring out. So that book at that time was called Essentials of Pediatrics, the first edition of Dr. Ghai, and it was brought up by the Mehta offset printers. Later, because of copyright reason, the book had to change its name. It became Ghai Essential Pediatrics. So I sat in the department, helped him to edit, and learned the art of writing scientific papers, scientific publications under his tutelage. In 1981, I was finished my senior residency. I had just 3 months to go. I had got a job as lecturer in PGH Chandigarh, and I told him I am going. He said, you are not going anywhere. You are going to sit here and do the work in this department. I may not be able to give you a lecturer job, but continue here. I worked for a pool officer, much to the point of Dr. B.N.S. Walia, who came down from Chandigarh to take me. He said, Dr. Ghai said, no, he is not going. He will sit here. I was happy. 3 months later, I came with my wife Beena here. I was happily passing my time as lecturer. Then he told me, you are not going to do like this. We have to develop something. In this department, everybody would develop a subspecialty. So you decide for next 2 days what you want to do. I thought it will take a week. Day 2, he told me, what did you decide? I said, I'm just thinking. He just pulled my hand, walked from the third corridor, from pediatrics over to medicine department, opened the door of Professor M.M.S. Ahuja's office, took me there and told Dr. Ahuja, this is the boy who will do pediatric endocrinology for me. From today onwards, you will report to him. And all of you know how hard a taskmaster Dr. M.M.S. Ahuja is. From next day onwards, he will send word for me, where are you? After your clinic, come to me. And 3 weeks later, we found a space on the third floor OPD of the Rajkumari Amrit Kaur block. We started our first clinic day. And Dr. R.K. Menon, Dr. Vijayalakshmi Bhatia, Dr. H.P.S. Sajdev all joined me in writing the books. I thought we will start some clinics, find patients and come over and start everything. At 4 o'clock in the evening, I get a Mr. Kaimal, PA to Dr. Ahuja, came to me. Dr. Ahuja is calling you. Come with your patient to the second floor seminar room. We will see what all cases you have seen today. So we started the first interdepartmental conference on the first clinic day itself of pediatric endocrinology. So it has been a great work, a visionary who identified people like me and much more people. I think if you look at the department, every single faculty has been appointed with a vision to develop a subspecialty, a special project. So that was a visionary, and if I keep talking about him, there is no end. We can keep on talking. But I have to say that I am also proud, not only with AIIMS, but also with my undergraduate training at Calicut Medical College. There I came to know. Actually, Calicut Medical College was also born on 1956, 2 months earlier to AIIMS. I did not know about AIIMS when I was doing MBBS. But I found a variety of teachers, including in pediatrics, who are from AIIMS and who actually taught and behaved in a different manner compared to all other teachers in the medical college. Most prominent among them was Dr. Shanta Kurup. Maybe none of you may know her. She is the second batch pediatrics MD student from AIIMS after Dr. O.N. Bakku, along with Dr. Saroj Mehta. She was the first person. I thought when she took classes, there was something called logical approach to clinical decision making, without any of these words we are knowing about in medical education. Then I had teachers in microbiology. Many of you must have learned his book on microbiology, Dr. C.K. Jairam Panikar, again second batch of MD microbiology from AIIMS, and the third batch, Dr. Gopalakrishnan. Then in surgery departments, he came across people who were actually teachers from various disciplines like urology, cardiology, cardiothoracic. All of them have made distinct names, super academicians during their lifetime. Some of them still continue. Then I came over. 1974 August was the time I joined AIIMS. And when I came, the AIIMS department, pediatrics, was a very small department. We had just 7 faculty members. Dr. Ghai was the professor, Dr. Sita Sinclair, Dr. Meherban Singh were assistant professors. Others were all lecturers at that time. Dr. Veena Kalra had just joined as lecturer in the department. We had a neonatology Department. Dr. Srivastava used to run the nephrology department. Dr. A.C. Verma used to have the genetic clinic. So we had only 3 specialty clinics at that time in the afternoon. One for genetics on Monday, one for nephrology on Thursday, and one for high-risk baby clinic run by Dr. Meherban Singh on Tuesday. Later Tuesday had to be stopped because combined round and grand rounds and CPCs are to be done on Tuesday, so no clinics were done in AIIMS. So shifted to Thursday again. At that time, not only these faculty members, I was also introduced to several faculty members from other disciplines who will be coming to pediatrics for consultation teaching. And the most dedicated faculty that I saw at that time was Professor Rajan Tandon, in cardiology department. I think single-handedly he taught me how to logically, clinically approach any pediatric problems. Doesn't matter what your diagnosis is, it is the logic behind making that diagnosis and a working diagnosis and going ahead with your treatment plan that is the most important. There was nobody more astute in clinical diagnostic than Dr. Savitri Srivastav. So much so, we never thought they were in another department. We thought that we can go and call them, talk to them in their office at any given time, and they would come to the department and see whether it is a cardiac case or not. Felicitation Jane will vouch with me. We had a patient with severe ascites and liver disease. We could not make any diagnosis. We knew that he must be having extreme degree of hepatitis or cirrhosis, dying through. At 3 o'clock, 4 o'clock in the evening, we didn't know whom to call. He said, let us call Dr. Tandon. And he came. He saw and he said, it is not constrictive pericarditis. It is not congestive cardiac failure, but let us see what we can do. So that was the dedication of the faculty of AIIMS that I saw, which was a world different to me. And then I saw dedicated taskmasters as my senior registrar, Dr. Ved Chowdhury, VP Chowdhury, who moved from our department to hematology as professor and head, was my first senior registrar. Very difficult person to hide away from or get away from duty. And then Dr. Lakshman Singh Arya also joined later from Jabalpur in our department. We had a pediatric neurologist by name Dr. Kuldeep Kaur Sajdev, who left later, and she taught us the fundamentals of neurology to us, everything. What was more important was that I found a whole and quite a number of other people who are not here. I am thankful to them because they taught me basics of pediatrics and how to treat others. This oration would not have been possible but because of Professor Ghai. I think anywhere in India you go, to any medical college, everybody knows O.P. Ghai. That is the name and the prestige. It has been, I know because I am editing several books, it has been actually the #1 textbook for undergraduates in pediatrics and the most concise. And I am happy that the tradition of this book is being carried down by 2 younger colleagues of mine who are his esteemed students, Dr. Vinod Paul and Dr. Arvind Bagga. They continue to edit, and I am happy to be part of the authors in this book, still editing the chapter on endocrinology with Dr. Vandana and Dr. Rajni. It's this whole oration is essentially because of him, and I am thankful to him for that. A lot of other younger people joined me in my journey to the department as a senior resident to faculty till I left the institute. So I cannot put everybody's name. I have just put people who have actually joined academic institutions. Some of them are in highlights. The black highlights show who has continued as faculty in this institution. So the tradition is going from MBBS to MD to departments, from Dr. Arora, Dr. Vinod Paul down to Rakesh Loda, Shefali and Rajni Sharma, whom I have taught even as undergraduate students at some point of time. I am proud to say that we have internationally recognized faculty like Dr. Ramkumar Menon as our student, and Dr. Vijayalakshmi Bhatia, who is heading the first department of pediatric endocrinology in India at SGPGH Lucknow. And Dr. Anju Virmani was my first MD student who did a thesis under me on a topic on pediatric endocrinology. And others are also in that particular stage. I am what I am because of these people. I learned with them. Many of them are actually far superior to me and taught me more about pediatrics than that. My learning in pediatrics was not possible, but because of the genetic unit which was attached to the Department of Pediatrics, I think which should have been an independent department even in those days. Such a great department which taught us about what lab and laboratory medicine is for clinical diagnosis. I am forever thankful to the directions and to work under the unit with Dr. Ishwar C. Verma, who was a guiding light for me in all research activities. And I am happy that Dr. Madhulika is continuing in that way, guiding so many people with a DM in the clinical genetics in this department. I am thankful to every single member of the genetic unit with whom I had chance to collaborate and work and learn about genetics and laboratory techniques. Whether it was simple radioimmunoassay to HPLC to genetic text, everything I learned from them. Maybe I am not expert, but I can. And there were other colleagues like Dr. Savita Sapra, who is a clinical psychologist, and laboratory people. Even they taught me a lot of things, how to work and all. I am indebted to them. I also learned a lot from sister disciplines. I think pediatric surgery was next door to us in AB5. I think Purushottam Upadhyay sir was a visionary, and our DSD clinic, it used to be called Intersex Clinic, was started with the help of Dr. Mridula Rodgi. She single-handedly taught me how to palpate for testis and hernia and how to go about for laparoscopy, and also run after the pathology department to find out the lab findings of biopsy specimens. Forever, and I think I have no end to it. Dr. Mitra, Dr. Devendra Gupta, Bhatnagar, Dr. Minuvat. I think the pediatric surgery was an appendix to our department during that time. We never felt which is our duty room or their duty room, except for the fight for the seminar room in AB5. We had fantastic support from pediatric radiology. Thursday after lunchtime conferences with Dr. Sneha Bhargav. We used to look forward to every meeting. And later Dr. Arun Gupta, who took up pediatric radiology, and Dr. Seema Mukhote, who used to do when he is not around. Younger colleagues have taken around. I think I miss all of these people now. Of course, I would not have learned much of endocrinology without the help from Endocrine Society, from Dr. M.M.S. Sahuja, who guided me and sent me for fellowship training to Middlesex Hospital in London, and also the clinical and lab techniques from Dr. Kochupillai and Dr. M.G. Karmarkar and his assistant Dr. Madan Godbole, and my contemporary in medicine and endocrinology, Dr. late Srimati Amini. I think they all taught me a lot. I was thankful to reproductive biology department for their support establishing in a hormone lab where many of our assays are still being done, and nuclear medicine. I am so happy that Dr. Bal is sitting here. We started with Dr. Gopinath, the father of probably the department here, and then Dr. Padi, Dr. Arun Malhotra, and you have hired, and I think I am proud that I have publications along with you in fantastic journals on very interesting clinical situations. And I learned basic biostatistics with Dr. K.R. Sundaram and Dr. Pandey, and how to read a pathology slide under Professor Meera Mathur, who dedicatedly looked at every piece of gonadal tissue that we took away from the patients. There are several other departments, but I think it will be too much to go ahead. So let us now stick to the topic, that is development of pediatric endocrinology. Even worldwide, pediatric endocrinology is a relatively new department compared to cardiology, neurology, or even gastroenterology. I think the credit for establishing pediatric endocrinology units in the world and to Europe goes to Professor Andrea Prader in Switzerland, who started independent clinics, who later decided that let us have interested faculty members discuss problems related to pediatric endocrinology in the form of a club called Pediatric Endocrine Club in 1962. After the club was formed and the members turned around to be in 30, they decided, let us have an official meeting in Zurich. That was the beginning of the European Society of Pediatric Endocrinology, which was formed in 1965. I think Professor Hengweiser was the first person to collect articles from different authors in Europe and come out with the first textbook of pediatric endocrinology in Europe as well as in the world. The British group was formed subsequently in 72, and I think British endocrinology and diabetes group was later formed in 1975. So you can imagine they are relatively young specialty. But what ESP has done in the years was great. They have thought that academics training is most important, and they helped me. I think I have benefited from this, and I think Professor Dr. Anju Urmani, my first student, and quite a number of our young endocrine colleagues have all benefited from the fellowship offered by ESPE for short-term and long-term training in an advanced endocrinology center in Europe. They have a journal, and I think Professor Ahuja and Dr. Ghai were of the opinion that I should not go for long-term training abroad so that there is nobody to look after the department. Instead, call specialty-oriented training in our center. Ask people to come and work for a week or month, depending upon their availability, train us to do these things and set up these services here. So first we had the first person was Dr. Michael Ranke from Leuven in Germany, who came for teaching us how to do growth hormone studies in AIIMS. Then from Germany, I think currently Dr. Vandana is associated with Dr. Olof Hjort and team. They come periodically with programs. Then we had the British team who came with Dr. Grant and Charles Brook. Charles Brook finally took me for a training in Middlesex Hospital in Great Ormond Street. Then we had the pediatric bone mineral physiology team consisting of Dr. Murray, Sulf Mughal and Raja Padidela. They all have come and stayed in AIIMS, stayed not in big five-star hotels but in our faculty club, faculty guest house rooms, and come for training, teaching, and showing us how to do reading of the X-ray, how to do evaluate, and then make a diagnosis. Dr. Magdalene Forrest and Nathalie Josso came at the calling of Professor Mridula Rothgi, stayed for 2 weeks to set up our pediatric DSD clinic. And then Dr. Carroll came from France, and then colleagues in Australia helped me to develop this clinic. So when I was there, I was really impressed with the way the Bibles of Pediatric Endocrinology was written by Charles Brook, which is now in the 7th edition. And Mehul Dattani was just a senior resident working at that time. And now he is the prime author of this particular. Mehul Dattani is an Indian born in Bombay, who is now a British citizen working there. And this is the Pediatric Endocrinology Diabetes, is the first textbook on diabetes and endocrinology that has come. Simultaneously, North America also developed. I think the two centers who developed pediatric endocrinology were Baltimore and Boston. The John Hopkins called Professor Lawson Wilkins, who was in private practice at that time, for teaching purposes to John Hopkins, and then developed the pediatric endocrine program. What is great about Dr. Lawson Wilkins is his clinical teaching. He used to conduct case-based discussions to the residents in pediatrics. His publications, early books, are still worth reading because of the exclusively beautiful diagrammatic illustrations of clinical approach to diagnosis that he has written, handmade. I think still worth going through those old books if available. He was single-handedly useful in developing such books. I think our colleague Dr. Vandana has taken a leap in that you have produced a book on case-based discussions. I think illustrations are important in understanding and learning. It speaks much more than words. And then Dr. Talbot came and Boston became the center. Then the Lawson Wilkins Pediatric Endocrine Society was formed. It continues to be LWPES for a long time. I used to attend their meetings once in 2 years. It was an educational learning. I met a lot of people, including Dr. Marianu, Dr. Spicer, Mark Sperling, and other people, and learned to interact with them, invited them over here to train our students over here. And this was probably, North America was the first one to start a certified program on pediatric endocrinology. And also, they showed us the way that if you have a difficult problem, then sit together and make consensus reports. That will guide you how to best manage a given solution. So, several consensus reports have come from the Lawson Wilkinson Pediatric Endocrine Society members. I had just listed a few like 21 hydroxylase, including the currently activate problems like the health or the transgender health starting from childhood. So they continue to make these consensus guidelines, periodically update them. That is what is important about it. It is not just important to write one consensus report, re-evaluate and see whether in the present context of knowledge it remains the adequate form of resource for a review problem. And also, it started what we call as the specialist or the special interest groups of people who are interested in a specific, for example, neonatal hypoglycemia group, patients for rare diseases of adrenal enzyme deficiency, all were started by these groups and for their training. And with that came the standard textbook from USA, which started the Sperling. If you can read carefully, I want you to show that the third author on the book on the left is Ram Kumar Menon, our own distinguished alumni. That is where our students have come and has become leading scientific lights in the field of pediatric endocrinology. And I used to read Williams and D. Groots in our days as of first learning of, still they continue to be the guidebooks for leading endocrinology, whether for adults or other for children. Development on this side of the Atlantic was much later, which Australia leading the light for development of pediatric endocrinology. It was in 1982. I think many of you must have met Dr. Martin Selling, Dr. Gary Vaughan, who has made multiple visits to this institution and wrote the first chapter on DSD in our book on pediatric endocrine disorders. Dr. Sinclair had come for several DSD workshops later with Dr. Rodgi and Dr. Professor D.K. Gupta, and helpful in establishing clinical pathways of managing DSD disorders. And I am thankful to Dr. Margaret Shakarin, who had come he has become almost a citizen of India, teaching students on varied topics in very important forums. And Dr. Maria Craig, who has actually taken Indian experts in the realm of International Diabetic Forum with every issue of ISPAD on diabetes guideline. Every year, every consensus has at least 3 Indian experts contributing the specialties on low social or low resource come into special perspectives on them. So it is very important to identify people who are pro towards us and help us in managing, because it may be very difficult to follow the guidelines as is practiced in UK or USA. We have to have guidelines which help us manage our problems. So the Asia Pacific Pediatric Endocrine Society was a beginning, and the best thing about this society was the training for the postgraduates, which is the APPS PET School, Pediatric Endocrine Training School, I think it started with Dr. Anju Urmani attending the first one, Dr. Anurag Vajpayee, and quite a number of people like Dr. Vandana, Rajini. All of you have probably attended these schools. It is a different type of training program in which students interact with faculty, discuss case-based problems, and arrive at how to manage better. A different way of continuing medical education, a new visa of medical education. And I must say that APS has finally came to India, and we had the biennial meeting of APS just last month in Yashobhumi here, and I think we had Vandana was a faculty in that. I was also there along with other Indian faculty. I am thankful to Dr. Rajesh and Anju Seth for organizing this meeting for us here. And these are some of the figures of the thing. I think Gary Vaughan has been a person till he retired from Sydney. He used to come almost every year and attend and stay with us, and he was made a honorary fellow of our society. On the photo, large photo on the left, you can see Dr. Gary Vaughan, Dr. Margaret Saccharin, Chris Cowell, and the Japanese colleague Riko Horikawa. These all have helped us in training our own people, lab technicians, and also in helping us with international research collaborations. Now, we have just not regional societies, we have become global. Now what we call as, we have a GPED, the Global Pediatric Endocrine Disorder. So we had the first meeting of a global society this year in end of October and in November. Online meeting where people from even low resource groups like South Africa, West Africa, South America all presented, and we could interact with them. And I must thank Dr. Ganesh Javalikar, who was part of the organizing team, and I think many of our colleagues, I think Dr. Vandana was speaking about DSD and surgical management in this particular group, and you said on vitamin D. So the Indian expertise and Indian research work has become world accepted through this forum, and it has opened up a avenue for us to present our, I think generally a feeling is there that we are little down, we are not so high and research oriented. So maybe, but there is a way in which we clinically manage, that is a distinct way of management with the limited resources. That should also be told to the other world. So don't fear. I think this was a message given to me by Professor Ghai also. Learn to share your experience, how simple it is. So I encourage people to present how you managed situations which are very difficult in your own intelligent, logical, methodical way. So we learn from everybody and continue learning. Most of the endocrine work actually was endocrine disorders. I was told that Lawson-Wilkins was essentially allergic to diabetes, never discussed a case of diabetes in his discussion. So diabetic societies came little later, and ISPAD has taken over as the mentor for training academic activities with their journal Pediatric Diabetes. And ISPAD also helps to conduct annual meetings and training programs. And they sponsor younger colleagues, and I hope those who are sitting in the backside, younger colleagues, you can get a training fellowship with ISPAD, with your daily expenses covered with an honorarium for 3 months to 6 months to train in pediatric diabetes, various aspects in a center of your own choice. Pediatric endocrinology as an organization came much later to India. It is actually 1 year after I had joined as a faculty. The official beginning was in 1982. The visionary was Professor Menon Desai at Bhai Jarbai Wadia Hospital in Bombay, who had the brainwave of organizing the first national symposium on pediatric endocrinology at Bombay. It was supported by the Commonwealth Federation, British Council, DST and ICMR. What is great about this meeting was that Dr. Desai wrote to every single medical college, asked the Department of Pediatrics to nominate a faculty member interested in pediatric endocrinology to come for this meeting with all expenses paid. They have to stay there for 3 days, attend to the sessions, make presentations. I was one of the few assisting faculties for this department. So we had 300 people participating. That means almost 150 medical colleges sent their own faculty for this training. The same group, Professor Ahuja brought bundle and all to AIIMS, and we had in lecture theatre another North Indian session, here also for 3 days. They all stayed. It was wonderful working with them. And that probably was the beginning of a subspecialty chapter under Indian Academy of Pediatrics, for which the first office bearers was Professor Meena Desai, and the secretary was her assistant, Professor Priska Kolaso, working from Bombay. I became the second president with Dr. Anju Virmani as my secretary, and then other well-known professionals in the field took over, like Professor Raghupati from Vellore, Dr. Anju Virmani, Nalini Shah from Bombay, our own Dr. Vijayalakshmi Bhatia from Lucknow, all have become presidents and office bearers of this organization. It was formally changed to an organization society called Indian Society for Pediatric and Adolescent Endocrinology, ISPE, in 1987, because we had to work as a registered society to gather funds, to do independent research. So these were done in 1987, 2007. And we have now quite a number of life members, associate members. That means we can have diabetic nurses, diabetic dietitians, and adult endocrinology colleagues interested in all can become members of the society. There are no restrictions on them. And they conduct regular training programs, PET schools, for training of postgraduates, not only in MD but also in DM and fellowship programs. And we have now almost 15 well-recognized pediatric endocrinology centers offering training of short-term and long-term. Institute was the first one to start a pediatric fellowship program with the help of the academic section here. And I think the first person who joined me as Pediatric Endocrine Fellowship was Professor Anju Seth, who is currently the head of Department of Pediatrics at Lady Hardinge Medical College, followed by Dr. Archana Arya, who is in Sar Gangaram Hospital, Dr. Shaila Bhattacharya, who is at Manipal Hospital and Devangiri Center. Quite a number of other people have come here and sent. And I think this fellowship, which is given under the research fellowships category of AIIMS, I think is a boon for the younger people, younger faculty members, and should be encouraged. And if possible, duration and time should be increased. Now, ISPE supports a short-term training of 3 to 6 months of a selected faculty member from any center to come and stay in a center of their choice. So they can also come to AIIMS. I think Dr. Vandana must be getting application. Institute doesn't have to pay for this. We also run a journal of which I am the editor-in-chief under the society, which encourages publication from younger colleagues, which is now, at the moment it is not PubMed, it is but online, and it has got a wide citation at the moment with invited articles, editorial commentaries from experts from abroad. It has become very popular at the moment. And the society, it is not done because of my effort. I think I was helped through this by a number of people, starting with, from the left, Professor Meena Desai, her colleague Dr. Priska Kolaso, both from Bombay, Dr. Nalini Shah. Dr. Nalini Shah is an MD Pediatrics who did DM in endocrinology from Vellore and joined and started the DM program in KEM in Bombay. Dr. Aspi Irani, who independently started first diabetes clinic in Bombay, and currently the chairperson of the Juvenile Diabetic Organization of Maharashtra. And what is important is he conducts annual diabetes camps in distinct areas for patients and their families. And currently, Dr. Sudha Rao, who is actually must be starting the fellowship training program under the National Board of Examination for this. This is a group where we show that international faculty and our faculty training our own students, and you can see many of the younger colleagues who have become distinct faculty in other medical colleges. Maybe you may find some of you among them. I think some of you can identify yourself in there. So we went on with developing further national symposia. Again, second was done in Mumbai. Subsequently, it was held in institute in AIIMS and also in other places. And then formation of the units. First in Vijayawada, officially recognized unit. Second in AIIMS, followed by in Christian Medical College, Vellore by Professor Raghupati, Dr. Anna, as well as SGPGI with the joining of Professor Vijayalakshmi Bhatia as a faculty member. Now we have centers in other places also, like PGI Chandigarh and other places. The clinical services we started here in 1982. We had at that time joint clinics, seminars and general clinics. I think the adult endocrinology teaching on Friday morning used to be dedicated to pediatric endocrinology, with pediatrics residents presenting along with the DM and other students. I think Dr. Goswami would be remembering these sessions which used to be held in the lecture theatre on 3rd floor, where we used to have. Also, we were supported by faculty from endocrinology and other departments in establishing assays. I cannot say less about Dr. Karmarkar, who has independently guided me along with Dr. Madan Godbole, and coming with lab support for many of these things. And daycare facilities for testing observation. For the first time, we started calling patients for GH testing and other testing to the ward, like we used to do before that only for thalassemia transfusions at that time. And then we had the first diabetes nurse educator, Shobha Setia, coming and showing us how to do nursing education and independent patient support, and Anuja Agarwala helping us with dietitian for the patient. She used to come and sit in every clinic and take diet history and call patients and do. I think I was ably supported by these teams. So if you say, I must say Dr. Ghai guided me. Dr. Ishwar Verma was the philosopher and the guiding spirit in establishing services. I was fortunate to have Dr. Anju Virmani, Dr. Vijayalakshmi Bhatia, Professor R.K. Menon, Dr. Madhulika, Dr. Anurag Vajpayee as my colleagues in the initial years of development of this department. And also I am eternally thankful to Professor M.M.S. Sahuja, Professor N. Kochupillai and late Dr. Amini, who handheld me in actually. I went through making several mistakes, but they were polite and guiding in correcting me and taking me through the right path in a pleasing and teaching manner. We have now training centers in pediatric endocrinology. First officially recognized training program, that is postgraduate diploma certificate course of PDCC, was started in SGPGIM under Professor Vijayalakshmi Bhatia. I think it is 10 years old now. A number of people who have been trained in PDCC have become faculty members in various parts of India, including PGA, CMC Vellore, in AIIMS Patna and other places. In addition, they also offer additional training for 1 or 2 years, depending upon availability of seats, for these people to continue their training. Now such training is available in Vijayawada in Mumbai, in Jahangir Hospital, in Pune under Dr. Baman Khadilkar, Bengaluru under Shaila Bhattacharya, Kanpur under Dr. Anurag Vajpayee, and now more and more centers are coming up. Formal training fellowships have come in AIIMS Bhopal, Jodhpur and Rishikesh. I think many of these faculty members were trained here with Dr. Vandana, and they have established, and National Board has actually been thinking of officially recognizing this training program as DNB and FNB, and the first inspection for approval of a center for FNB has happened in Bhai Jarbai Wadia Hospital in Bombay. Maybe other centers will follow, and I am told that CMC Vellore also is on the way. So they are all part of the international training programs. While we were developing, other endocrinology centers also have been throwing their foot to develop pediatric endocrinology. I am eternally thankful to Dr. Dash in PGI Chandigarh, who has trained quite a number of MD pediatric students who have done DM in endocrinology. So they have become faculty in different centers. You can see two distinguished luminaries sitting in one of the meetings held in AIIMS here. And Sanjay Bedada, who is currently the head in the department in endocrinology in SGPJ, is actively in pursuing pediatric endocrinology. Dr. Vijayalakshmi Bhatia on the right side has become the head of department of pediatric endocrinology, first department to be formed in pediatric endocrinology at Lucknow. We hope that will come up with new faculty members. I am happy that our own DM program students, like Dr. Amrish Mittal, first DM program at AIIMS, Dr. Ish Bhatia, MBBS MD student at AIIMS, and Dr. Preeti Dabadgaon, all are now faculty in SGPGI Lucknow, and they have the PDCC program, and hopefully they will have a DM program very soon. DM programs has now come in other centers also. Dr. Raghupati started the program in CMC Vellore, now in Indira Gandhi Institute of Child Health at Bangalore. Dr. Anna Simon has been responsible for the pediatric endocrine unit. At the moment, the endocrine 1 unit of CMC Vellore consists of Dr. Anna Simon, Dr. Sara Matai, and Dr. Nayak. 2-3 faculty members are in one department. So I hope they will get a recognition to start an FNB as well as DM program. Dr. Vaman Khadilkar has been following up the program in Pune, and now other AIIMS probably would find it easier to develop this program. Though there are a lot of intramural activities that are going on. I think even AIIMS is also part of an intra-departmental teaching along with PGI Chandigarh. SGPGI is associated with several other institutions like Amrita Institute, DM programs in southern India and other places. Even BHU with their DM program is actively promoting pediatric endocrinology at the moment. So establishing clinics have been very easy in AIIMS because of the supportive nature, and lab supportive was very much there, and I think we could go to Dr. Bal or Dr. Arun Gupta at any given time and get help done. It is wonderful to have specific studies, nuclear functional studies and all, and to have supportive faculty in sister disciplines like pediatric surgery who help us with managing difficult problems in this thing. Also, we now have patient support groups, education materials prepared by our own team, and have started. I think the first step in starting postgraduate training in AIIMS was allowing senior residents to do training in a chosen specialty of theirs for 1 year as a part of senior residency rather than doing just routine pediatric training. I think that has evolved into development of DM programs in many disciplines in pediatric nephrology, pediatric oncology, and to name a few. So I think it will continue in this way. A lot of publications also have come from AIIMS in my time. I just showing a few just to show landmark publications. For example, I was invited as a faculty member to contribute to the ISPAD guidelines as early as 2014. I was surprised that I was called to write on complications of diabetes. Currently, I think 8 faculty members from various organizations are contributing to the consensus guideline, which is now looked upon as the Bible of managing pediatric diabetes. I think we have come a long way in establishing. The paper down on the left side is the first time the importance of subclinical hypothyroidism was mentioned as a marker of undiagnosed short stature. When it was published in Journal of Pediatric Metabolism, the editor wrote to me saying that a very good training module is needed to recognize. These are things which will probably not be seen by well-trained institutions. It's on our own Indian things. Similarly, we also have to define our own problems related to diabetes. I think Dr. Narendra Mehra and the team, as well as the autoimmune laboratory studies that has been done, are helpful in establishing these tests. We also could develop a CAM. I think 1987, it was a brainchild of Professor Ahuja to have the first CAM, and it was held at the guest house of AIIMS in Shimla, Rajkumari Amatkau guest house. We took 40 families of diabetic children, and I hope you can see a very young PSN Menon in the second photograph sitting down. You can see Dr. Ahuja, Dr. Karmarkar, Shobha Sethia, Anju Virmani, and a lot of people staying with the faculty for 3 days there and doing everything. Outreach programs, I think you are doing quite good at the moment. We have several programs like IDLs, S for school teachers, training for dietitians, diabetic nurse educators. It is also important to develop supporting staff for all these. When we started our diabetic growth clinics, we did not have growth charts. The only growth chart available was a publication by ACMR in 1979, which showed the growth trajectories of low-income socioeconomic group prepared by Dr. K.N. Agarwal. I think we hand-made our own growth charts, and the growth chart on the left was the same growth chart prepared at SGPGA Chandigarh when Dr. K.N. Agarwal became the director of SGPGA with Dr. Vijayalakshmi Bhatia as in the Department of Pediatric Endocrinology. You can see the difference in the pubertal growth spurt because it's all not longitudinal studies, it is cross-sectional maps. And second graph shows that plotting the same thing, that chart, on the CDC charts, that 50th percentile of our growth charts are far, far below the 50th percentile of the well-nourished children from USA. Now we have progressed, we have got growth charts of our own, it is available at your beck and call on a mobile device. You can also plot it in your clinic. You can also calculate BMI in this particular chart. Lot of studies have come on growth hormone from this institution, and I think I wanted to say that genetic lab and genetic departments have been extremely helpful in these studies. And radiology department has helped me with the studies on the MRI technology of pituitary hypothalamic region. And also, I think I should thank the Drug Controller General of India for allowing me to study the first growth hormone recombinant study in India and making it available on routine basis for use in India. Puberty, I think we all have learned. What have we learned about puberty is that we have learned how to diagnose precocious puberty and delayed puberty. But what has prompted our clinic is that it has established the routine use of orchidometers. The orchidometers are available in India, prepared under the banner of ISPE at a cost of around 1,500 rupees. You don't have to spend a fortune to get it from other countries. We have categorized. I think our residents routinely use SMR charts for evaluating puberty in the clinic, and also the chart on the right side shows that evaluation of growth of precocious puberty children ending up as short. All these have become the routine of managing pubertal disorders in the clinic, in addition to starting treatment with recombinant GnRH analogs. Thyroids, I think landmark, I think I have learned a lot from Dr. Kochupillai about iodine deficiency. I think we cannot keep on talking about it. But the study by Dr. Anju Virmani about hypothyroidism, then about how badly the children are performing, those with hypothyroidism treated early but not by newborn screening. And also, I think Dr. Bal would remember about this study last on the right on dysgenesis, how we have studied routine use of nuclear medicine in evaluation. Finally, we have now newborn screening has come. I am sad that after the ICMR multicenter study, we are not doing the newborn screening now, but I think it will come, restart. And I am happy to see the collaboration from AIIMS in the consensus guidelines about newborn screening for hypothyroidism in 2 mark documents produced under the banner of ISPE, published by Indian Journal of Pediatrics. I am especially thankful to Rajini, being one of the leading authors of this particular publication, even though a lot of other members have really contributed that. So we have come with Indian-based guidelines. A lot of studies, I think we are thankful to genetic department. I think I learned about a lot of genetics of doing screening for congenital adrenal hyperplasia from my colleague and PhD student Dr. Roli Mathur, who was responsible for doing simple, cheaper methods of genetic testing for common diseases. Now the same test is being promoted by CMC Vellore, and they offer that for 8 common genetic mutations at a cost of 800 rupees. I think the genetics unit of Department of Pediatrics should come with such simple, low-cost methods of diagnosing common pediatric, endocrine and other problems. So I think Dr. Madhulika has done a lot in this matter, but I think this is a lesson for sister disciplines to follow. I think I would not have learned anything about DSD without Professor Mridula Rotki. It was unfortunate she died in an accident later, but how to deal with DSD, how to diagnose them, how to follow them up, how to use all available methods to make a correct, precise diagnosis and then decide about surgery, and patients to sit with diagnostic text, whether it is a ultrasound, CT scan, genitoscopy or a laparoscopy, and going back to the lab, pathology lab, to see the tissue histopathology. I think she taught me how to do it. I would not have learned it otherwise. No pediatric textbook, no pediatric training provides such training. I think that's such a clinic. It is a clinic which is done only in this institute, All India Institute. I think the cooperation of multidiscipline, genetics, pediatric surgery, psychiatry, psychology, pediatrics and other disciplines to work at the health of genital health of children is important. Now finally we have the DM programs. The first DM program has come in PJ Chandigarh. Students have passed out. It is 2 of them have passed out, but 1 of them have joined a medical college. 1 is in private sector. I think we have the DM program under AIIMS also has come. I am told that the 3rd DM program has been approved for AIIMS Bhopal under Dr. Maheshwari. and they will start probably advertise for it in the next session. I think there are, yes, this year. I think DNB programs also will be there, but I think that doesn't, fellowship training program should go simultaneously with such a DM program because the number of seats available are much less. It is just not enough to start DM programs or MD program. There should be enough learning resource material for students to learn about the subject in general. That vision came with Professor Meena Desai when she invited me and Dr. Vijayalakshmi Bhatia to write the first textbook of pediatric endocrinology for postgraduates. I'm happy Dr. Anju Seth has joined us as editor in the 4th edition because of the falling health of Professor Meena Desai, and it is now in the 4th editions. There are several other books now that have come up for pediatric, but our book still continues to be probably the prime learning resource in the textbook form for pediatric endocrinology. I think many of you postgraduates must have seen this book, and I would welcome your suggestions to improve this book in the days to come. And I have learnt a lot with my colleagues who have contributed chapters, both international and national. So we have gone a long way. So where are we now? The biggest problem that pediatric endocrinology units face in other institutions are development of sophisticated laboratory supports to diagnose complex biochemical molecules like 17-hydroxyprogesterone, androstenedione, or C-peptide. These are not routinely available in many medical colleges. So we have to now concentrate on this. It should not be department-based. It should be a facility-based central system where everybody can approach such development system, whether it is LCMS or whether it is flowmetry or anything that should be coming in the way. We have to improve our imaging technology. We have now moved away from MRI to MRA, spectroscopy, PET scans. Imaging has revolutionizing our method of diagnosis, and isotope technology has helped us to understand functional physiology of most endocrine disorders now. I think any neonatologist sitting here with managing a hypoglycemia knows how valuable it is to get a nuclear imaging FDOPA studies in difficult cases. And also, lastly, molecular genetics has come a long way in making early diagnosis now possible so that we can start treatment, and the treatment also has become genetics oriented, genetics based. Also, it is essential that we have to percolate our knowledge to regional centers. So we have to identify regional groups where there are sufficient number of people who can. Because if I go to Kerala, I find that there is only one faculty member in the 8 to 10 medical colleges there. It is very difficult to work them as independent entities. So it is important they join together and work together to advance the training of students, postgraduates in endocrinology. Such groups have already formed in many other states like Karnataka and other places like Chennai. So I hope Delhi used to have a pediatric endocrine club. I think it should function very regularly and then educate, and we should involve the postgraduate students in this particular program. And we also have to be part of the CME programs, and we should encourage people to come and be observers in our centers. Also, it is just not training postgraduates and undergraduates. We have to make responsible documents for public health responsibilities. So each department, whether it is pediatric endocrinology, pediatric oncology, cardiology, I think we have to make resources for the general public about how best to manage their diseases, where the best help is available, to meet material which are simple, educative, to understand the disease much easier. I think ISPE has started several such locally available. We have a program on video on newborn screening, which is prepared in Telugu, Tamil, Kannada, as well as in Malayalam, in addition to Hindi and English. Such things are the need of our being the multi-state, multilingual society. And I think we have to promote, I think, whether it is endocrinology, whether it is cardiology or neurology, growth and development and part and parcel of every pediatric training. And I think it has to percolate and should not be at the subservient level of training program. Whether it is just growth retardation, malnutrition, to obesity, everybody. And also, we have to learn now that as we are advancing with the advanced management, newer diseases are coming. People with diseases which hitherto was not considered to be treatable or survivable are now becoming problems with the late onset of disease. For example, survivors of pediatric malignancies. In the days when we were training, there was not a surviving was important. Now survivors are common. We have to see that they survive and have a adequate, healthy support by appropriate monitoring for late onset development of adverse complications. It is just not endocrinology. It can happen in other departments. Children who are operated at early age for congenital heart disease, they will survive. Children who are born small for date in neonatology wards, they are going to develop problems at a later age with metabolic syndrome, growth hormone deficiency. So it is important that pediatric endocrinologists become aware of these problems and work together with other subspecialty training. And lastly, I think the need of the hour is newborn screening. I think we cannot get away from this. It is the right of every newborn to get to know whether you have a disease. It is just not hypothyroidism or congenital adrenal hyperplasia. It is many metabolic disorders which can be treated early enough to prevent adversities, disabilities, and probably even you can change mortality and morbidity by appropriate early management. So, pediatric endocrinology is now a career option like any other subspecialty. We should encourage more pediatricians to opt for this. I think I would, if I can encourage anyone amongst the younger postgraduates here to take up a career, I would be most happy. And I think we have to modify our undergraduate and postgraduate training to inculcate pediatric endocrinology as a part. I think the most important is to introduce them as examination. I think most of the people who are sitting here as MD pediatrics know that they never had a case or a problem or even a question in the theory paper on endocrinology in their exam. We could get away without it. No, I think every specialty needs to be included in the training program in examination so that training is directed towards that. And there should be training programs not only for the postgraduates and the physicians but also for the general public to make awareness about common diseases. So I have said a lot. I have come a long way. I am at the end of my career. I would still be counseling, but I think it is for the younger colleagues like you to take up these issues in your own chosen specialty and go forward. I think I hope done enough justice to the trust Professor O.P. Ghai has shown in me when he took me to Professor Ahuja's room in 1981. I hope I have lived up to his expectations and I bow my head in front of him. Thank you for listening to me.
Thank you so much, sir, for the excellent and enlightening oration today. And now I request Professor C.S. Pal, sir, Dean Examinations, to felicitate, sir.
He's coming?
Also coming.
Director sir is also coming. You can speak.
Okay. I can speak about Dr. Menon as much as you want. But there is very short time and I don't want to stand between you and the lunch. So let's have a short intake. When I joined in 85 as a MD student in the institute, I was not knowing Dr. Menon. But when I came to nuclear medicine, I interacted with him almost daily basis. That time, this congenital hypothyroidism was very big issue. Dr. Meena Desai had made a lot of hue and cry, and everybody is talking about how to diagnose. And in those days, in nuclear medicine, imaging with technetium per technetium scan, which cost hardly 15 paisa to do a scan and diagnose immediately whether it is a utopic thyroid or ectopic thyroid or agenesis or hemiagenesis. All these were very simple. Just you spend 15 paisa to get the diagnosis. You don't need any very sophisticated investigation. And ultrasound used to be 6 weeks date, and nuclear medicine he will just send with a small slip and it is done in 15 minutes time. So you just give 1-2 millicurie of pertechnetate. After 15 minutes you take a scan for 2 minutes and the diagnosis is made. And we had a very good interaction. And that time in India there was no MD program in nuclear medicine. There was only DNB. So we wanted to start a MD program. So in 95 he was served in academic. That was only was served in those time, and he was to be the privileged position. So we submitted a proposal, and he called me one day. He told, Bal, in your department nobody has got this MD degree and you are the only qualified person. He told, sir, everybody will come up, don't worry. There are few of them are DNB also. So he was very gracious. He took it to the program. And we 95 our first MD program started, which is very successful. And we used to get all the first top 10 rankers as nuclear medicine, and we have almost contributed 30% of best nuclear medicine physician in US is all trained under us, because there was no MD program in nuclear medicine residency in US. They used to have only 1 year program after doing radiology, 1 year short training program, and we used to have 3 years training program. So they did our first 10-15 batch of our students all are everywhere. You can go to Harvard, the best pediatric neurologist and endocrinologist, nuclear medicine physician is combined. 4 things he is doing from us only. So we have all over the country. But one thing, Dr. Menon, which he was, Dr. Ghai's vision was that to develop the subspecialty, and which every branch needs subspecialty. And I would go after he was talking about 82. I will be talking 2024. It is not subspecialty. Now you are not a specialist in a subject. Now you have to be disease specialist. My daughter did MD medicine, did fellowship in oncology, did fellowship in Memorial Swan Catering. She does only in myeloma. Rest of her life she is doing myeloma. And she is in the 3 years time has a publication in Lancet. So that's why telling, I don't see, except myeloma, I don't see even look at any other patient. So that is how they have developed. That's why Dr. Menon was raising one question, why Indian research is substandard. The reason is we are victim of our own success. In All India Institute, if you see 100 patients in a day, how will you document it? We have plenty of resources, but we don't have that intellectual time to sit down and write all this material, to collect all detailed information. 2 branches in medical science are very elegant. One is where the physician can tell, okay, you have got anterior cerebral artery injury or there is obstruction. This is a neurologist, because it is not because the neurologists are very smart, because the brain is hierarchically organized. You can touch a point and you know which part of the brain is getting stimulated. So that's a neurology. The other one, which I always tell to Dr. Goswami, I always pull him, is the endocrinology, where everything can be measured. And they modulate their drugs, they diagnose very precisely endocrinology. So endocrinology and neurology are the 2 most forefront, where physician can be quickly make the clinical diagnosis, which any other imaging you do, you will find the same diagnosis. You can just confirm it. Endocrinology, everything can be measured, you can diagnose. And fortunately, for last 40 years, I do only thyroid. And I do only thyroid cancer. That's why all 40 years, I have treated more than 12,500 thyroid cancer patients. I spend, out of 8 working hours, I spend 6 hours every day in thyroid. And on that basis of my work, 2 American Thyroid Association guideline recommendations based on my work. Earlier, people used to give 300 millicurie, 200 millicurie for remnant ablation. My first study, randomized control trial, and the American told that you can never have a randomized control trial in thyroid cancer because it's so low incidence. And the first randomized control trial study I started in 90, and 100 for 149 patients, it took 5 years. And it became published, and first randomized control trials demonstrating that 30 millicurie is as good as 100 millicurie. Then there was criticism that it has to be small number, so you have to do. So then another study I did in 2001, published in Journal of Clinical Endocrinology Metabolism, 509 patients. And then whole world started seeing, and then there was 2 national trials confirmed. So what I'm trying to say, confirming to Dr. Menon, we have to we do pediatric endocrinology. There are several aspects. You can, starting from DSD, you can have hypothyroid, you can take thyroid, you can take diabetes, you can take adrenals, you can take pancreas. But what you need, apart from doing 10 other things, one thing your heart should beat for that. And if you take one disease and decide, I will contribute this rest of my life, whenever you see the patient, internally your spirit should go up. Yes, this is the patient I want to challenge. I want to see it. So that's how you collect more of information. It may not be overnight, you will be famous, but it takes years, decades to become famous. And that is how that names Dr. Menon was taking. Dr. Meena Desai, I know her at least for last 50 years. She is doing the same thing. She's all contribution in thyroid, phenomenal. So that's why people will remember you. You do 10, because not like Harvard, there are 250 endocrinologists. But we have only 2 endocrinologists in pediatric endocrinology in our institute, Dr. Bandana and Dr. Rajani. So one of them or both of them should decide this is the area where we can contribute. That Dr. Sefali is doing that, developmental neurology. She wants to only do very meticulous work. Similarly, somebody has to take one area, develop it, go to the depth it, and then publish it in international journal, their journal, because you have to publish in their journal to show that this data is validated. Then it can come to the guidelines. Thank you. And my interaction with Dr. Menon is very, very, very cordial. And one thing I want to his handwritings are very beautiful. Doctors are always, the doctors write very badly, but Dr. Menon's handwriting is just very, very meticulous. Nicely you can read even these notes. So because Dr. Gopinathan Nair and Dr. Menon had a lot of interaction, and I always show my resident, see Dr. Nair, Dr. Gopinathan Nair notes. He was a physician, and then he went to UK, got the MSc in nuclear medicine. He was the first person who developed this endocrine department in our. So even it's today, if you see the writings of Dr. Nair, is phenomenal. So meticulous, so detailed, 3-page history. Then now these residents write only 3 lines or 2 lines, maybe sometimes 1 line. So what I did, I made a format, at least you put the tick mark. Okay, that also is becoming, because they have to see 110 patients, 120 patients. They don't have time. So we are victim of our own success. All India Institute, we have now 22 All India Institutes, but again that will take years and decades of effort. So some people should dedicate in some area, and like Dr. Goswami has worked on hypoparathyroidism. No, sorry, yes. Idiopathic. No, not only hypopara. Hypopara can be surgical. He works on idiopathic hypopara, all aspect of it, and he has got, I think, he has got the highest publication from India in Journal of Clinical Endocrinology Metabolism. Of course, I could not publish that many. I had only 6 or 7, but Dr. Goswami has more than 15 publications in JCM. So that's one area he works. He has got 200 odd patients following for them last 40 years. 30 years is following them, going to their house, getting the drug, getting all the genetic study. That's why you have to go at one area and do. That's what I will suggest my Vandana and Rajni, to take one area of endocrinology, pediatric endocrinology, try to develop more in that, contribute something to the science. Apart from doing patient work, everybody has to do that. What is the difference between us and across the road? There is no difference. If you will just go and prescribe drugs, go home, relax, no, that is not for which All India Institute was created. Thank you. We are waiting for Dr. Sir.
So, may I request our senior professors who have come to attend this session, Professor Jain, Professor Lobo, if anybody wants to say something, or Dr. Naseem. just a few words.
I don't think I have anything else to say. That I have known Dr. Menon from the day he entered All India Institute of Medical Sciences. And I'm lucky that I was associated with him for some time at AIIMS. But I mean, even though we haven't met for years in between and all this, but our bonding is the same. And that is what PSN Menon is there. I mean, I will not talk of endocrinology and all. As far as he was talking about the same thing and all this, one of the reasons, other than seeing so many patients at All India Institute, they are not able to develop even in the private sector is because there is no money. If you are sticking to, let us say, myeloma all your life, you earn no money. You know, that is the difference between abroad and all this there. If you are this thing, you still get a lot of money, but in this country, you don't get money. The other day, I was talking to the director, Dr. Srinivas, and all this, that we should go in for this thing, that this institution should become absolutely a referral center. And the people should not be going directly to the AIIMS and all. So I think with Professor Srinivas, and we are also working in the modalities, how we can do about it, if necessary, even we may go to the court, that they should develop some kind of a system by which they can cut down on the routine patients in the All India Institute of Medical Sciences. Thank you.
I'm Dr. Nasim Shah. I was the chief of the dental center. For people who do not know me, because I see very many younger faces here. So my association with Dr. Menon is on a purely personal basis. He was our neighbor and father of two beautiful daughters, and I had a son. And we had very good bonding, children playing together, going to each other's house, and having a very good social life. So suddenly Dr. Menon left, and after many, many years, when I saw him in one of the WhatsApp group, I was thrilled, and I just took his phone number and I called him up. And our contact got re-established. I could talk to his beautiful wife, Beena, who is sitting here, and we have promised to revive our association again, and we'll be meeting. And we had very many common friends like Dr. Amini, who was in endocrinology, who was also my contemporary in the hostel, and we continue to have relationship with her family, even though she is not there. And I look forward to reviving our relationship. Thank you, Dr. Menon.
Dr. Vasudev, if you want to say something.
Thank you, and it's a pleasure seeing Dr. Menon. We often have been associated with him since 1984 when I joined AIIMS in nephrology, and after that with him for a few years. But after leaving the country, he's been visiting quite often, and we have been interacting in one of the other conferences. And as Dr. Menon was mentioning about Dr. Ghai, we were traveling together. I was fortunate to have traveled with Dr. Ghai to China and Taiwan for a conference, and we were together for about 5 days, and he interacted a lot with me. And he was telling me how these specialities came up in 1981 in AIIMS. In 1977, there was an international conference in India, which was hosted by India and AIIMS. And in that 77 conference, there was not a single study or a paper from AIIMS. And that really shook him. And what was the reason? Then he said, then I kept studying, and the reason was we were just seeing malnutrition, diarrhea, pneumonias, things like that in AIIMS, and AIIMS was not meant for that. And we were seeing hordes of patients like any other general hospital, and that is why we could not devote any time for research and publications. So then he said that I decided that we must have specialities in pediatric also, and then he handed over one specialty to each person without asking what he would like to take. And Dr. Menon was given endocrinology, Dr. Mehrbaan Singh was given neonatology, so on and so forth. And he was telling me when I gave neonatology to Dr. Mehrbaan Singh, he came back to me and he says, I am such a huge, tall, hefty person, and these small, tiny babies, I can just handle in one hand. How would I see them and palpate and do that? So change my specialities. So he said, nothing doing now, we have just distributed, just do one specialty, and that is how we will develop. And that was the beginning which Dr. Menon was telling us 1981, and then after that, of course, the specialities developed and everything developed. And Dr. Srivastav, I was fortunate to have worked with him. He came back from Afghanistan in 81, and then pediatric nephrology developed, and I joined with him in 1985, and then after that, we have been together for last 40 years now. And it's a pleasure seeing all the luminaries here, Dr. Jain, Dr. Lobo, and all the senior people. And we have been interacting at various fora, but Dr. Menon also. Thank you very much. It's a pleasure having you, Dr. Menon. Thank you very much.
We now proceed with the felicitation function. I request Dr. Bal to kindly come and felicitate, sir, and Dr. Madhulika, ma'am. Dr. Pankaj Hari, sir, please, you also join. I actually request all departmental colleagues to kindly come forward and join for the felicitation of sir. All faculty from the department.
Of the slides so that the background is not right. Otherwise, because we will not be talking. Are they-